Intrapartum fetal heart monitoring. So firstly, there's the early stage. Before this, we need to know as a graph. So this phase is nothing but the onset. This is the recovery. Below, looking at the contractions. This point is the nadir. Keeping this picture in mind, we're going to go further with the explanation. So firstly, the relationship to the contraction. Let me draw it in rough. This is what we saw. These are nothing but the contraction. So here it's symmetric to the contraction, as well as next the nadir is of deceleration. It corresponds to the peak. Peak of what? Peak of the contraction. And as well it is gradual. So what is gradual? Gradual is nothing but it is greater than or equal to 30 seconds from onset to the nadir. This is the onset, this is the recovery. So here, looking at the etiologies which are responsible for this condition. Etiology is nothing but the fetal head compression, as well as it can be normal fetal tracing. Next, we are going to look at the late. So this is in relationship with the contractions. So firstly, we have this diagram. As we know, this is the onset, this is the recovery, and the dip, this is the nadir. And here what we are seeing is the contraction happens prior to the nadir. And now looking at the relationship to the contraction, here it's delayed compared to the contraction. The nadir of deceleration, it occurs after the peak of contraction. Next, the progress, it is gradual. That is, it is greater than or equal to 30 seconds from onset to nadir. Next, we are going to look at the etiology where this happens, that is a cause. Etiology is nothing but the cause. Under etiology, it can be the utero-placental insufficiency. Now looking at the next, it is nothing but the variable. Case of variable, looking at the diagram, onset, recovery, this is the nadir, and next we have the contraction. So the points to note here is in relationship to the contraction, it can be, but not necessarily associated with the contraction. Another point to note is it is abrupt. The previous two conditions, it was gradual. Abrupt in the sense it is less than 30 seconds from onset to the nadir. Next, there is also a decrease that is greater than 15 per minute, and the duration, if you see, is greater than or equal to 15 seconds, but less than 2 minutes. Now, looking at the etiology of this variable type, it can be due to the etiology. It can be due to the cord compression. It can be due to the oligohydramnios, as well as the cord prolapse.